So today we're going to talk a little bit about having original Medicare and also the options of adding a supplement plan or a Medicare Advantage plan and why it's important to have the additional coverage. So we'll start with step one with what's considered original Medicare. That consists of Parts A and Part B. Part A covers your inpatient hospital stays, skilled nursing facility. Part A usually does not have a premium associated with it as long as you've worked more than 40 quarters, which is like 10 years because you've paid into that your entire working life. Part B covers your doctor visits, outpatient hospital visits. Part B does have the monthly premium associated with it, and you pay your Part B premium no matter which plan type you choose to enroll in. The standard Part B premium for 2024 is $174.70 per month. This premium is income related, and they always look back 2 years to determine your premium. This is income related, so if you have the higher income levels, this does increase your Part B premium. So if you only have original Medicare A and B, this only covers 80% of your medical costs, leaving you exposed to the other 20%. And that 20% is uncapped. So that leaves you exposed to 20% of the cost of who knows what that medical bill could be. Nobody wants to be in that situation. We've had people come and talk to us who only have original Medicare A and B, and they've experienced maybe a recent inpatient hospital stay or a bad medical diagnosis, and they are surprised to see that they owe thousands and thousands of dollars in medical bills because there's no cap on that. So we don't want anyone to be in that situation. So think of having original Medicare as your prerequisite to having your Medicare plan. So once you get Parts A and B in place, then we move to step two, where you want to pick up your Medicare plan to fill in all those gaps that original Medicare leaves behind. So for step two, there's two plan type options. Option one is a Medicare Advantage plan, known as Part C. Option two is to add the supplement plan, and these are often referred to as Medigap. Both of these options are strong options. They both do the same job of filling in gaps original Medicare leaves behind. They're just structured differently, so they do the job differently, and you pay for them differently. So for option one, Medicare Advantage, known as Part C, think of C as combine, because these combine your Parts A, B, and your Part D prescription drug coverage all into one plan. You carry one card. These are offered by the private insurance companies, and this is the pay-as-you-go option. They typically have a $0 per month premium, no deductible usually, so you're covered from the start from day one, and then the way you pay for the plan is through copays when you use the plan. So say the plan has a $0 per month premium. You'll be paying your Part B premium, the $174.70, but then you don't pay anything after that unless you go to the doctor or pick up a prescription. Medicare Advantage plans also have the out-of-pocket maximum, so this is a good thing. This is your safety net to protect you. If you have a medically catastrophic year with a ton of medical bills, this is the most you'll have to pay out of pocket towards those medical bills. Can average $3,400 up to $6,000 a year on a Medicare Advantage plan. Also with Medicare Advantage plans, there's networks associated, so you want to stay within your provider networks. But since this option's gotten so popular, the networks are pretty strong, pretty robust. Medicare Advantage also has the embedded benefit, so they're going to cover things for you like dental and vision and hearing aids, flex account cards, over-the-counter allowances, and free gym memberships. The other option, option two, is to add the supplement plan, and these are referred to as Medigap. Supplement plans work alongside original Medicare. So Medicare pays first as primary, and then the supplement plan is secondary to Medicare, picks up that 20% that Medicare leaves behind. Supplements do have monthly premiums associated with them, and you'll pay that in addition to your Part B premium. There's no networks associated with supplement plans, so as long as the provider takes Medicare, you can go to any provider in the country. And with supplements, since you're paying that higher monthly premium, there's little to no out-of-pocket costs on a per-service basis. So the way that works is, for 2024, there's a $240 annual deductible with a supplement. Once you've paid $240 towards your medical bills for the year, the supplement plan pays 100% of your medical bills the rest of the year, because you're paying that higher monthly premium for it to do that. But supplement plans are only medical coverage, so they're not going to cover things like dental or vision or hearing aids. They also don't cover your Part D prescription drugs, so you would just want to pick up a standalone prescription drug plan. The premiums for those range from $0 per month premium up to around $100 a month or more. Everyone's needs are different with their Medicare plan, so here at RetireMed, we're going to help you find the plan that's right for you. If you only have original Medicare A and B, we highly recommend that you give us a call. We can explore those additional plan type options for you and the additional benefits that you might be eligible for.